Hey everybody, it's Coach Nick and welcome to the second installment of our Exercise Science Basics video series. If you are here from the Introduction to the Skeletal System video, welcome. If you have not seen that video yet, I will leave the link for it in the description below. Today's video in our Exercise Science Basics series is going to be the introduction to the musculoskeletal system and the tendons. Just how we broke things down for the introduction to the skeletal system, we will do the same thing today. Our first topic is going to be the general organization of the muscles in the human body. From there, we're going to move on to a discussion about muscle fiber types. We will then talk about the different types of muscle contractions. From there, we'll talk about some of the special attributes of muscle tissue, and then we will finish up in a discussion on sarcopenia. So without further ado, let's get started with our first topic of discussion, general organization of the muscles in the human body. The average human body consists of a total of 430 muscles. Now the first thing that we're going to take a look at when we're looking at how these 430 muscles are organized in the human body is going to be what is represented by this black marker right here, and this is going to be a muscle tendon. On either end of all the muscles in your body, there is a tendon, and this tendon is what is going to connect muscles to bones so that the muscles can pull on your bones and allow movement to happen. So that's your tendon, that's the black marker. With the red marker right here, this is going to symbolize muscle tissue. Now, when we're looking at a muscle as a whole like this, it is referred to as a muscle belly. The fancy clinical term for that is a muscle gaster. And this muscle belly can be anything, bicep muscle, pecs, quads, calves. And on the outside of all the muscle tissue in your body is a layer of fascia. Fascia being the fancy term, just generally referring to any tissue covering. Around all the muscle is this fascial covering called the epimysium. So the epimysium is on the outermost layer of all the muscle tissues. It covers all the muscle tissue in the human body. Now, within the larger structure of the muscle belly, there's a further bundling, breakdown, or structural organization of the muscle tissue. Now, these bundles inside of the greater muscle belly are referred to as muscle fascicles. You will also see them referred to as muscle fasciculus. These are synonyms, these are interchangeable terms, they both refer to the same thing. Now, these bundles of muscles, the fascicles, they need to be further separated by another layer of that same fascial, shrink-wrap, filmy-like material, and the tissue that surrounds the fascicles is referred to as the perimysium. So we have the epimysium, which covers the entire muscle belly, and then within the muscle belly we have these muscle fiber bundles called fascicles, and they are individually surrounded by their own layers of perimysium that separates them out from the other muscle fascicles inside the larger muscle belly. Now, even within these muscle fascicles, there's an even further layer of structural organization that goes on, and these further bundles within the muscle fascicles, these are individual muscle fibers. Now, much like the fascicles that they are bundled within, these muscle fibers also have their own surrounding layer of fascia. When it is surrounding the individual muscle fibers, it is referred to as the endomysium. So, entire muscle belly surrounded by the epimysium, broken down further into bundles referred to as fascicles or fasciculus, which are surrounded by perimysium. The muscle fascicles are then broken down further into individual muscle fibers, which are surrounded by the endomysium. Now, within individual muscle fibers, there's an even further breakdown in the structural organization, and these very small organizations within individual muscle fibers are going to be referred to as myofibrils. Now, the myofibrils inside the muscle fibers, these are things called actin and myosin. We're going to revisit these in larger detail later on. But just to review the general organization of the 430 muscles in the human body, Muscles have tendons on both ends that connect them to bones, allowing muscles to pull on the bones to allow for movement to happen. The muscle belly or muscle gaster is the entire muscle, and that is surrounded by a fascial layer called the epimysium. These muscle bellies or gasters are broken down further into bundles referred to as muscle fascicles or fasciculus, which are surrounded by perimysium. These bundles or fascicles are broken down further into individual muscle fibers, which are surrounded by the endomysium. These muscle fibers are then broken down even further into things called myofibrils, called actin and myosin, and we will revisit those in greater detail later on in the video. So the next thing that we want to zoom in on a little bit when we're looking at the general organization here, now that we have checked out the muscles, we want to take a zoom in on the tendons. So as we know, there is one tendon on each side of every muscle, and that is what attaches muscles to bones so that they can pull on them. Now, as we learned in our video about the skeletal system, the outer covering of bones are referred to as the periosteum. The periosteum is what the tendon, signified by our black marker here, connects to directly. So tendon connects to the periosteum. So compared to muscle fibers, which have the capability to stretch and elongate and have some plasticity to them, tendon by comparison is very stiff. There's a little bit of give to it, a little bit of stretch, but tendon is very stiff. It needs to be able to transmit the forces from the muscles into the bones, and that stiffness is what allows that to happen. Comparatively to muscles, which have very good blood supply thanks to all the great artery and veins that run through them, tendons by comparison have significantly less vascular supply. It's not completely avascular, there is still blood supply there, but it's less, and the result is that tendons typically adapt more slowly overall than muscle tissue does, and it is also why tendons can take longer to heal than muscle tissue. So tendons connect to bone periosteum, and in between the beginning of where the muscle tissue is and where the tendon is, there's an undefined length of zone that is referred to as the musculotendinous junction. And the musculotendinous junction is the transitional period from tendon to muscle tissue. Now, the closer to the tendon part of the musculotendinous tissue is, the greater percentage of the overall tissue is going to be more resembling muscle tendon, and the further you are to the muscle side of the musculotendinous junction is where the tissue is going to be a greater percentage more similar to the muscle tissue. The musculotendinous junction is where a lot of injuries occur. The last thing for us to discuss when we're talking about the general organization of the tendons is going to be the names of where the tendons attach to the bone periosteum. Now, before we do that, we have to talk about what anatomical and functional position is, because these are the references that these things are named off of. What anatomical position is that picture of the guy standing with his palms forward and then the lines going through it and all that. That is anatomical position, and then functional position is just the same thing, but your hands are more down to your sides, palms turned in rather than forward. Now, with that image in mind, we're going to talk about the names for the first attachment site right here, and the first term for this that we'll be using is the proximal attachment. So keeping anatomical and functional position in mind, the proximal attachment site is the attachment of the tendon and muscle that is closer or more proximal to the midline part of the body. So if we're looking at the biceps, for example, the proximal attachment is going to be the one that's up here, closer to the midline of the body. You might also see the proximal attachment referred to as the superior attachment. Same reason why, using the bicep as the example here in anatomical position. This attachment is higher up or more superior on the body compared to the other attachment site that is lower down. And then the last term that can be used to define this attachment site is the origin. The origin is where the muscle is considered to start, so to speak. But origin is the oldest term for this tendon attachment site. It's the one that you're least likely to still see used in a modern day textbook. Proximal attachment is what you're most likely going to see, and then maybe superior after that. But origin is a term that has kind of been worked out a little bit. Now, when we're talking about the other attachment site, the names that are used to refer to this are going to be the exact opposite of the names used to refer to the other attachment site. So starting with proximal, the other attachment site is referred to as the distal attachment site. Looking at our anatomical position here using the biceps, this insertion point is more distal or further away from the midline of the body, so it is referred to as the distal attachment site. Similarly, the inferior, the exact opposite of our other one, when we're looking at our anatomical position, this attachment site of the bicep is lower down on the body or inferior to the other attachment site. And then the opposite term that is used as opposed to origin for this is the insertion. This is where the muscle is considered to end or insert itself onto the bone. Similar to origin, insertion is the oldest version of this term and is the one that you're least likely to encounter in a modern day textbook. You're most likely going to see distal and then inferior attachment used. So that's going to conclude everything about the organizations of the muscles and tendons in the human body. Our next major topic of discussion in our introduction to the musculoskeletal system is going to be muscle fiber types. We're going to be talking about 3 general categories of muscle fiber types for the purposes of this video. The first type we're going to talk about are called type 1 muscle fibers, also usually referred to as slow twitch, sometimes also referred to as slow oxidative, which you'll usually see abbreviated down to SO, and then also sometimes referred to as red muscle fibers. All these names refer back to the same thing, which is the type 1 muscle fiber. Now, the reason why the type 1 muscle fiber is referred to as slow twitch is because these muscle fibers, relative to the other ones in your muscles, they have a low overall force production capability, and they also have a low rate of force development. So they don't produce a lot of force and they don't produce it quickly, hence why they're referred to as slow twitch. They're also referred to as slow oxidative, the slow being the same reason for slow twitch. The oxidative component of that name being type 1 muscle fibers have a very good vascular supply, a lot of blood vessels, they are extremely dense in mitochondria, they have a lot of myoglobin, which is the oxygen transporter for the muscles. So all of those things lend to greater use of oxygen for muscular energy, hence the oxidative component of that part of the name. They're also referred to as red muscle fibers because in appearance they are a deeper red color owing to that increased vascularity or vascular supply and the increased presence of the myoglobin, as we already discussed. So these type 1 muscle fibers, low in force production and rate of force development, but very durable. So the types of activities that you're going to see these slow twitch type 1 muscle fibers active during are going to be low intensity, long duration cardio activity, sometimes during very low intensity, extremely high repetition strength training. The next type of muscle fiber that we're going to be talking about is the type 2A muscle fiber. Now, type 2A muscle fibers also have different names. These are usually referred to as fast twitch. And then the type 2A muscle fiber is also referred to as fast oxidative glycolytic, usually acronymed down to FOG. And then these are also usually referred to as white muscle fibers. The type 2A muscle fibers compared to type 1, much higher in force production capability in terms of the overall amount of force they can produce, but they also have a significantly higher rate of force production, so they produce more force and they produce it more quickly, hence why they are referred to as fast twitch in type 1, slow twitch. Fast oxidative glycolytic, the fast the same reason as why it's fast twitch. Oxidative glycolytic is a reference to these muscle fibers' preferred metabolism. We'll learn about this a little bit more specifically when we talk about the bioenergetics of exercise. but the FOG comes from the fast twitch nature, the fact that it is capable of using certain amounts of oxygen for energy metabolism, and then the glycolytic pathway is where that is going to occur. These are also referred to as white muscle fibers due to their appearance relative to the type 1. The type 1 muscle fibers, we learned a lot of blood vessels, a lot of myoglobin. Type 2, a little bit less vascular, much less myoglobin, hence they are going to be whiter in appearance. So, much higher overall force and rate of force development, but less durable due to the inferior oxygenation and vascular supply. The third category of muscle fiber we are going to talk about for this video are type 2X muscle fibers. Type 2X muscle fibers also are referred to as fast twitch. They are typically referred to as being fast glycolytic, usually acronym down to FG. So type 2A, fast oxidative glycolytic. Type 2X, just fast glycolytic. And then these are also referred to as white muscle fibers. So they are fast twitch for the same reason type 2A is fast twitch. They are white fibers for the same reason type 2A are white fibers. The fast glycolytic element, the fast is exactly the same. There is no O for oxygenation because these muscle fibers are present at extremely high intensity where oxygen is no longer probably a usable energy substrate, and that occurs all in the glycolytic pathway for these muscle fibers, so hence the FG. Now, these type 2X muscle fibers, they have even greater maximum force production compared to type 2A muscle fibers. They also have a higher rate of force development. However, they are also the least durable of these three types of muscle fibers. So as you see, there is an inverse relationship to how much force and rate of force development these different muscle fiber types can produce, and then how durable they are. The lower force capability they have, the more durable they are, as is the case of type 1. And then with the type 2A and type 2X, more force, less durability. An important thing to discuss when talking about muscle fiber types and which muscle fiber types are most active during certain types of activity, it's important to note that during no activity is only one specific type of muscle fiber active. During all activity, all the different fiber types are active. It's just in varying ratios. So when we're looking at higher intensity exercise, which by definition will also have to be lower duration, you are still going to be using your type 1 muscle fibers. You are just going to be using your type 2 muscle fibers in a much greater ratio than the type 1. Conversely, when we look at lower intensity exercise that can be done for a longer duration, intensity in this definition term meaning how close are we to your maximum capability at a given exercise, the lower the intensity is, the longer you can keep it up. Now, even though the intensity and force production might be lower and lower than what you need to get all of your type 2 muscle fibers going, you're still going to be using type 2A and type 2X muscle fibers. You'll just be using your type 1 muscle fibers at a much greater ratio than the type 2. The next topic for us to discuss are going to be the different types of muscle contractions, and in this video we're going to focus on the most basic three types, the first of which is called a concentric muscular contraction. In a concentric muscular contraction, the muscle is getting shorter. This is usually the up part, or sometimes referred to as being the positive of a lift. In a concentric muscle contraction, the amount of force being produced by the muscles is enough to overcome the amount of weight being applied during the exercise. So that is the concentric or positive, or usually the up part of a lift. The opposite of a concentric muscle contraction is an eccentric muscle contraction, also commonly referred to as the negative part of a lift. And this is usually the down or the lowering phase. Where in a concentric muscle contraction, the muscle gets shorter. In an eccentric muscle contraction, the muscle gets longer. Even though the muscle is lengthening and not shortening like in a concentric muscle contraction, it doesn't mean it's not producing force. It's just not producing force to lift the weight up, but force is being produced as the weight is being lowered. This is usually what results in the slow, controlled lowering part of an exercise. And the eccentric is usually referred to as the negative or the down part of most lifts. In the middle of these two things is an isometric contraction. And an isometric contraction is just holding a muscle or a joint in place. The amount of force being produced by the muscle is exactly equivalent to the amount of force being applied by gravity on the weight going down, with the result being that the muscle and the joint and the weight are all held in place, and that is an isometric contraction. So we have concentric muscle contractions where the muscle gets shorter and is producing more force than the weight being applied, and that is usually referred to as being the positive component of a lift. Then we have the eccentric muscle contraction where the muscle is getting longer during the contraction and it is producing less force than the amount of weight being applied through the exercise. That is usually referred to as the negative part of a lift. And then in the middle we have an isometric contraction where the force of the muscle equals the amount of weight being applied during the exercise, with the result being that the muscle does not change length and the joint angle is held the same for as long as the contraction is held at that level of force. So those are the three basic types of muscle contractions. We can now move on to our next topic of the video, which is going to be special attributes of muscle tissue. The next topic that we're going to discuss in our introduction to the musculoskeletal system is going to be about some of the special attributes of muscle tissue that sets it apart from the other tissues in the body. And the first couple of things that we're going to discuss on this topic are going to be something called specific tension, and then something very closely related to that called cross-sectional area, which is usually abbreviated down to as CSA. What cross-sectional area is basically a measurement of how much of a muscle is there. The amount of cross-sectional area is going to vary from muscle to muscle and individual to individual. The pecs and the quads, they're going to have a much larger cross-sectional area than, let's say, the biceps or the calves. And individuals who have been strength training, weight training, have more muscle hypertrophy, they're going to have a larger amount of cross-sectional area per muscle in general. Specific tension is a measurement of how much force can a muscle produce based on its cross-sectional area, and that is obviously going to depend on muscle to muscle, individual to individual, in the same exact way the cross-sectional area does. So that's specific tension in CSA. From there, we're going to move on to the next special attribute, which is efficiency of force production. So just like all muscles have varying amounts of cross-sectional area and specific tension that is muscle specific, they're also going to have varying amounts of efficiency of force production. Basically, how quickly and effectively can a given muscle generate force during the activity it's being called upon. And this is going to vary based on, are we talking about a large muscle producing a large amount of force one time? The amount of force production efficiency required for that is going to be very different than if we're looking for very small muscles that are producing repeated fine motor activity. So the efficiency per muscle is also going to be different, and some of that will also depend on training status and then the activity being performed. Now, moving on from these few things, we're going to move on to the next special attribute of muscle tissue, which is excitability. Now, what I mean when I say muscle has the attribute of excitability, muscle receives electrical impulses or signals called action potentials. We're going to learn about more of these when we learn about the neuromuscular system next video. But muscles receive these electrical impulses and they become electrically excited by them. And this excitability is what causes them to contract, to produce force, to cause muscular work to happen, and ultimately produce movement. So that is excitability. After excitability, we have the attribute of contractility. And this is the attribute where muscle can voluntarily and volitionally shorten while producing muscular force. After contractility, we have elasticity. So muscle is very elastic in that you can take it from its normal resting length, stretch it well beyond whatever that length is, and then when you let go of that stretch tension, the muscle will return back to its original resting state. This is elasticity. And then similar to elasticity, the muscles also have a certain amount of plasticity. And what plasticity is, if you stretch a muscle beyond its normal resting length and you hold that amount of tension of stretch sufficiently for long enough, you will get a plastic result, which is the muscle can potentially increase in its resting length, and that is plasticity. So that right there, that is just a short list of some of the special attributes of muscle tissue that makes it special and different from a lot of the other tissues and systems in your body. The last topic for us to discuss in our video today is going to be something called sarcopenia. If you recall from our skeletal system video, we learned about something called osteopenia and osteoporosis, which was the loss of bone mineral density that occurs with aging and inactivity. Sarcopenia is a very similar disease process, but instead of affecting the bones of the body and their mineral density, it affects your lean muscle tissue. So what sarcopenia is the loss of lean muscle mass and the ability to produce muscular force and power that comes with aging and inactivity. And this can hit people in their 50s, sometimes as early as their 40s. When it's really bad, sarcopenia can result in the loss of up to 10% of an individual's ability to produce muscular force, as well as a loss of their lean muscle mass. Sarcopenia affects all the muscle tissue in the body, but it has a preferential effect on type 2A and type 2X muscle fibers. These muscle fibers, as we learned earlier in the video, are responsible for large force production and power generation, which is why in sarcopenia, one of the hallmark signs of it is the loss of the ability to produce muscular power, and that is because we're losing the super fast twitch type 2X and then the type 2A muscle fibers. So the type 1 fibers are also affected by sarcopenia, but the type 2 fibers are selectively affected at a much greater magnitude. Now, luckily, sarcopenia can be stopped, it can be prevented, and it can also be reversed, and all it takes is well-structured guided strength training with appropriately used progressive overload accompanied with adequate protein intake. The last topic for us to discuss in our video today is going to be something called sarcopenia. If you recall from our skeletal system video, we learned about something called osteopenia and osteoporosis, which was the loss of bone mineral density that occurs with aging and inactivity. Sarcopenia is a very similar disease process, but instead of affecting the bones of the body and their mineral density, it affects your lean muscle tissue. So what sarcopenia is the loss of lean muscle mass and the ability to produce muscular force and power that comes with aging and inactivity, and this can hit people in their 50s, sometimes as early as their 40s. When it's really bad, sarcopenia can result in the loss of up to 10% of an individual's ability to produce muscular force, as well as a loss of their lean muscle mass. Sarcopenia affects all the muscle tissue in the body, but it has a preferential effect on type 2A and type 2X muscle fibers. These muscle fibers, as we learned earlier in the video, are responsible for large force production and power generation, which is why in sarcopenia, one of the hallmark signs of it is the loss of the ability to produce muscular power, and that is because we're losing the super fast twitch type 2X and then the type 2A muscle fibers. So the type 1 fibers are also affected by sarcopenia, but the type 2 fibers are selectively affected at a much greater magnitude. Now, luckily, sarcopenia can be stopped, it can be prevented, and it can also be reversed, and all it takes is well-structured guided strength training with appropriately used progressive overload accompanied with adequate protein intake. That will conclude today's video entry into our Exercise Science Basics video series. That was the introduction to the musculoskeletal system and the tendons. If you found this video to be enjoyable and or educational, feel free to give it a like. If there are any questions you have or anything that you would like to discuss further from the video, feel free to leave those comments down below. If this type of educational content appeals to you and you'd like to see more in the future, please consider subscribing to the channel. The previous video in our Exercise Science Basics series was the introduction to the skeletal system. If you've not seen that yet, the link to it will be in the description below. The next entry into our video series will be the introduction to the neuromuscular system. This has been Coach Nick, and I'll see you guys in the next one.